hour at the all-party meeting on coronavirus, the Health Ministry presentation said that the first to get the COVID vaccine will be health workers, nearly 1 crore of them. And then next 2 crores will be the frontline workers like armed forces, police, municipal workers, amongst others. That presentation was given by Union Health Secretary Rajesh Bhushan at that all-party meeting, which was chaired by Prime Minister Modi. So first to get vaccines will be the health workers, nearly 1 crore of them, followed by frontline workers like armed forces, police, municipal workers, amongst others. That's nearly 2 crore of them. Let's go across to Sunil Prabhu for more on this. Sunil, give us the details of the Health Ministry's presentation.
Well, at that meeting with the Health Secretary doing a fantastic job, I think they got beyond bipartisan support in terms of praise from all political leaders, including Mr. Ghulam Nabi Azad, who has been a former health minister and also the leader of opposition at present, praising the health ministry and the government for the way it's tackled these issues, in particular the pandemic. So that's a big surprise. Having said that, and as you pointed out, the 1 crore for health workers, the second 2 crores for those who are frontline workers from the armed forces, from the police, from municipal workers, amongst others. And then 27 crores of people, senior citizens, are expected to get that vaccine. That's the priority list in terms of the vaccines. Also, the approximate cost in terms of the Russians vaccine, which is approximately only $10. The others around 50 to 60. Those approximations were given. But how that cost is going to be borne, what is the way forward, those are details which are still being worked out, and there was no finality on that. But definitely in this meeting today, we saw some opposition leaders also raise the issue about the downtrodden and how they should also, and the poor should not be left out. They also should be part of this vaccine, and they should be able to get it. The other aspect, of course, being that the farmers' issues, which is now really uppermost on everybody's mind, was tried to be Mr. Balu, the DMK floor leader, attempted to raise that, but Mr. Prahlad Joshi, the Parliamentary Affairs, interrupted, saying, please stick to the issue. We are not going to discuss the farmers' issues, but definitely what is happening, those reverberations across this country in terms of the agitation for the farm laws, also getting some mention in the all-party meeting, but he was interrupted, not allowed to carry on. And of course, the focus, as I said, was on bipartisan support and encouragement to the health ministry as well as the government, which is quite surprising from persons like Mr. Ghulam Nabi Azad and others who praise the government in the way it is handling the issue.
All right, very interesting there. Bipartisan support to the health ministry's strategy to vaccinate people across the country. Thanks very much, Sunil Prabhu, for joining us with those details. And let's listen into what Prime Minister said at that meeting on the coronavirus situation.
करीब 8 ऐसी संभावित वैक्सीन है जो ट्रायल के अलग अलग चरण में और जिनकी मैन्युफैक्चरिंग भारत में ही होनी है। जैसा यहां चर्चा में भी बात आई, भारत की अपनी 3 अलग अलग वैक्सीन का ट्रायल अलग अलग चरणों में है। एक्सपर्ट्स ये मानकर चल रहे हैं कि अब कोरोना की वैक्सीन के लिए बहुत ज्यादा इंतजार नहीं करना पड़ेगा। माना जा रहा है कि अगले कुछ हफ्तों में कोरोना की वैक्सीन तैयार हो जाएगी। जैसे ही वैज्ञानिकों की हरी झंडी मिलेगी, भारत में टीकाकरण अभियान शुरू कर दिया जाएगा। टीकाकरण के पहले चरण में किसे वैक्सीन लगेगी, इसे लेकर भी केंद्र सरकार राज्य सरकारों से मिले सुझावों के आधार पर काम कर रही है। इसमें प्राथमिकता कोरोना के मरीजों के इलाज में जुटे हेल्थ केयर वर्कर्स, फ्रंटलाइन वर्कर्स और जो पहले से गंभीर बीमारियों से जूझ रहे हैं, वैसे बुजुर्ग लोगों को दी जाएगी।